Prior to implementing Experian Health solutions, we had primarily manual processes. There was a lot of them, and people were constantly trying to figure out how to resolve items, and you had inconsistency because you had one person doing one way, another way. And became clear that we had more denials than people thought, and we couldn't resolve them just by creating new manual solutions. ClaimSource as a module allowed us to better understand work queues that we couldn't create in Meditech. Meditech is a great native EHR and has many solutions that allow us to manage the AR of charges, certain components, but what it doesn't have is really functional work queues. ClaimSource brought the ability to organize things in a much more effective way that allowed our billing staff to effectively work the AR so that it was easier to see. The AI denial work source solution took it a step further. It really is a game changer in my perspective, the ability to understand our AR and how we can actually take whatever is done in ClaimSource and actually orient it more focused on denials. With the AI predictive tool, it allows us to give an additional work queue that is intelligent. That intelligence is built into three major components. The first component are those things that we thought would deny. So before it goes out, allows the biller to get a work queue that says, I need to fix those before they go out. So we're not caught in the denial collection loop, which instead of 30-day payment, you're looking at a 90 to 120-day period. So catching them up front is key. The second way that the denial tool works is that it allows us to have an intelligent work queue that comes back to us for each biller that says these are the claims with the highest dollar amount and the highest propensity to get collected on. It can be a lower dollar amount, but it's focused on both of those two factors that allow the billers to have a work queue that will keep them very focused and get us the best chance for collecting on those things that come back. The third thing that's most important is identifies all denials that are not going to be collected on. They can be small dollars, large dollars, but they create a large amount of claims that you have to go through one by one. If they're put into a group, they're able to be diagnosed and understand any new workflow that either can be created within Experian, within some other tool, or within Meditech to accept them out in the future or potentially fix them. But many times there are denials that are not seen, that we have individuals going through and clicking one by one, trying to fix them and realizing later they're not fixable. The ability to actually change that and make an intelligent work, I think, is one of the bigger things that the AI tool does for us.